Hello and welcome. Let me ask you a few questions. Do you find yourself reaching for junk food after a long, stressful day? Can you not resist the siren call of fast food, fried foods, or sugary sodas? Does the thought of walking to the corner store sometimes feel like you're training for a marathon? If any of that sounds familiar, you're not alone. We live busy lives, and these habits can easily creep in. But here's the thing, we all want a healthy heart. We all share the desire to live a long, vibrant life full of energy and free from illness. Yet despite this universal wish, cardiovascular disease remains the #1 killer worldwide. It's a staggering fact. So where's the disconnect? Often it's in the small, seemingly harmless habits we practice every single day without a second thought. But I have some incredible news for you. A huge part of your long-term heart health is completely within your control. It's not about some magic pill or a secret complicated diet. It's about understanding the real impact of your daily choices. Today, we're going to break down the 10 most surprising and damaging habits for your heart. These are things many people do without ever realizing the silent harm they're causing. And more importantly, for every single problem, we're going to give you simple, practical ways to turn them into habits that will protect you for years to come. Before we dive in, if you're serious about taking control of your health, make sure you're subscribed to the channel and have hit that notification bell. That way, you won't miss out on vital, life-changing health information just like this. Ready? Let's get started. Number 1, you forget about your mouth. That's right, we're starting with oral hygiene. You might be thinking, what does brushing my teeth have to do with my heart? The answer is, a lot more than you think. Your mouth is a gateway to the rest of your body, and it's teeming with bacteria. When you neglect your oral health, that bacteria can lead to gum disease or gingivitis. This isn't just about bad breath or sore gums. Gum disease creates inflammation and allows harmful bacteria to enter your bloodstream. Once in your circulation, this bacteria can travel anywhere, including your heart. It can cause systemic body-wide inflammation, which is a major driver of atherosclerosis, or the plaque buildup that clogs your arteries. In severe cases, it can even lead to an infection of the heart valves themselves, a dangerous condition called endocarditis. So what can you do about it? The solution is simple and effective. First, brush your teeth thoroughly at least twice a day. Second, make flossing a non-negotiable daily habit. It cleans the 40% of your tooth surfaces that your brush can't reach. And finally, see your dentist for regular checkups and cleanings. Think of your dentist as a key member of your heart health team. Number 2, you ignore snoring. For many, snoring is just an annoying nighttime noise, something to joke about with your partner. But loud, chronic snoring can be a serious red flag for a condition called obstructive sleep apnea. Sleep apnea is when you repeatedly stop and start breathing while you sleep. These pauses in breathing cause your oxygen levels to drop and your blood pressure to spike. Over time, this puts immense strain on your entire cardiovascular system. It's directly linked to a much higher risk of developing high blood pressure, heart attack, stroke, and even atrial fibrillation, an irregular heartbeat that can lead to blood clots. The physical vibration of snoring itself has even been shown to cause trauma and inflammation in the carotid arteries in your neck, which are the main highways for blood flow to your brain. So how can you fix this? If you're a loud, frequent snorer, it's crucial to take it seriously. First, if you're overweight, losing even a small amount of weight can dramatically reduce pressure on your airway. Second, try sleeping on your side instead of your back. And third, avoid alcohol before bed, as it relaxes the throat muscles and makes snoring worse. Most importantly, if your partner notices you gasping or stopping breathing at night, talk to your doctor about getting tested for sleep apnea. It's a highly treatable condition. Number 3, your binge watching and desk job. We live in a world of screens. Whether it's an 8-hour day at a desk or an evening spent binge watching your favorite show, we are sitting more than ever before. And this sedentary lifestyle is a silent enemy of your heart. Here's the crucial part. Prolonged sitting is dangerous even if you exercise regularly. You can't go to the gym for an hour and then erase the damage of sitting for the other 10 hours of the day. When you're inactive for long periods, your body's metabolism slows down. This affects the way your body handles fats and sugars, leading to higher levels of both in your blood, which directly contributes to your risk of heart disease, type 2 diabetes, and stroke. The solution is not to quit your job or give up TV, but to break the cycle of sitting. The key is frequent movement. Make it a rule to get up and move for at least 2 to 3 minutes every hour. Set a timer on your phone or watch. Walk to get a glass of water, do some simple stretches by your desk, or just march in place. If possible, consider a standing desk for part of your workday. Interrupting your sitting time is one of the most powerful things you can do to combat the risks. Number 4, you smoke or live with a smoker. There is no way to sugarcoat this one. Smoking is a complete and utter disaster for your heart. If you could see what a single cigarette does to your blood vessels, you would never touch one again. The chemicals in tobacco smoke damage the delicate inner lining of your arteries, making them sticky and prone to plaque buildup. Smoking also makes your blood thicker and more likely to form dangerous clots, which can block blood flow to your heart or brain, causing a heart attack or stroke. It raises your blood pressure, lowers your good cholesterol, and is a leading cause of nearly every type of cancer. And this isn't just about the smoker. Secondhand smoke is just as dangerous. Living with a smoker increases your risk of developing heart disease by up to 30%. Your heart doesn't care if you're the one holding the cigarette or just breathing the air around it. The solution here is simple and direct. Quit. There is no such thing as a safe amount of smoking. It is the single best thing you can do for your cardiovascular health. If you need help, talk to your doctor. There are countless resources, medications, and support systems available to help you succeed. And number 5, you isolate yourself. We often think of heart health in purely physical terms: diet, exercise, and genetics. But our mental and emotional health are deeply connected to our physical well-being. And one of the most overlooked risk factors is social isolation. Humans are social creatures. When we lack strong supportive connections, it can lead to chronic stress, anxiety, and depression. These emotional states aren't just in your head, they trigger real physical responses in your body. They release stress hormones like cortisol, which over time can raise your blood pressure, increase inflammation, and damage your arteries. In fact, major studies have shown that loneliness and social isolation can increase your risk of a heart attack by 29% and your risk of a stroke by 32%. That's a risk level comparable to well-known factors like smoking or high cholesterol. So what's the prescription? Nurture your connections. Make time for the people you care about: family, friends, neighbors. It doesn't have to be a big party. A simple phone call, a coffee date, or a walk in the park can make a world of difference. And if you're struggling, talk about it. Being able to share your worries with someone you trust is a powerful tool for managing stress and protecting your heart. Number 6, you eat the wrong foods. When we talk about a heart-healthy diet, most people think about what to avoid. Cut out the fat, the sugar, the junk. And that's important. But what's often more critical is what you need to add. The problem isn't just the presence of bad foods, but the absence of good protective ones. Your heart, like any high-performance engine, needs premium fuel to run well. That fuel comes from nutrient-dense whole foods. The two most celebrated heart-healthy diets, the DASH diet and the Mediterranean diet, are both built on a foundation of fruits, vegetables, whole grains, nuts, seeds, and lean proteins. These foods are packed with antioxidants, fiber, and healthy fats that actively fight inflammation, lower blood pressure, and keep your arteries clean. The solution is to shift your focus. Instead of thinking, "I can't have that," start thinking, "What good things can I add to my plate today?" Aim for at least 5 servings of fruits and vegetables every day. A serving isn't huge, it's about the size of a tennis ball. Swap white bread for whole grain bread. Add a handful of nuts to your afternoon snack. Choose fish, like salmon, a couple of times a week. Every healthy addition you make naturally crowds out the unhealthy options. Number 7, you overdo the salt. You might think you're good with salt because you don't add much from the salt shaker at the table. But the vast majority of sodium in the modern diet is hidden. It's lurking in places you'd never expect: canned soups, deli meats, frozen dinners, bread, salad dressings, and nearly all restaurant and fast food meals. When you consume too much sodium, your body holds onto extra water to dilute it. This increases the total volume of blood in your bloodstream, which forces your heart to work harder and raises your blood pressure. High blood pressure is called the silent killer for a reason. It damages your arteries and heart over years without any symptoms, setting the stage for heart attack, stroke, and kidney failure. What's the fix? First, start reading labels on packaged foods. You'll be shocked at the sodium content. Second, cook at home as much as possible. This gives you complete control over how much salt goes into your food. And third, become a master of flavor. Instead of reaching for salt, use fresh herbs, spices, garlic, onion, a squeeze of lemon or lime, or different kinds of vinegar. Number 8, you assume you're not at risk. This is one of the most dangerous habits of all, thinking, it won't happen to me. Heart disease is often seen as something that happens to other people, older people or people who are obviously unhealthy. High blood pressure, high cholesterol, and high blood sugar are often completely silent. You can feel perfectly fine while these conditions are quietly damaging your arteries day after day. Waiting for a symptom to appear is like waiting for the smoke alarm to go off after the house is already on fire. The solution is to know your numbers. This is non-negotiable. You need to know your blood pressure, your cholesterol levels, and your blood sugar levels. Get regular checkups with your doctor and don't be afraid to ask questions. Understand your family history. If your parents or siblings had heart problems, your risk is higher. For many people, the real key to maintaining healthy blood pressure isn't just about the heart. It's about supporting the body's master blood pressure regulator, your kidneys. A team of health researchers recently put together a free presentation that reveals a shocking discovery about how our kidneys control our cardiovascular health. It details how an ancient, powerful ingredient, sometimes called the crown of Jesus, has been scientifically shown to support this vital kidney function and promote healthy, flexible blood vessels. If you are at all concerned about silent warning signs, high blood pressure, or simply want to discover this groundbreaking natural method for yourself, I strongly encourage you to watch it. You can view this important free presentation right now by pointing your phone's camera at the QR code you see on the screen. If you're on a computer, or just prefer to click, I've also put a direct link for you in the pinned comment right below this video. Now, let's move on to our next habit. Number 9, you drink too much alcohol. This is a tricky one because there's a lot of conflicting information out there. You may have heard that a glass of red wine is good for your heart, and while some studies suggest a potential benefit from very small amounts of alcohol, this is a very slippery slope. For the vast majority of people, the risks of drinking alcohol far outweigh any potential benefits. Excessive alcohol consumption is directly linked to a higher risk of high blood pressure, elevated triglycerides, and heart failure. Alcohol is also packed with empty calories, which can lead to weight gain, another major risk factor for heart disease. So, what's the best approach? If you don't drink, don't start. If you do drink, moderation is absolutely crucial. That means no more than 1 drink per day for women and no more than 2 drinks per day for men. Number 10, you ignore your body's warning signs. As we get older, it's easy to dismiss new aches, pains, and feelings of fatigue. We chalk it up to just getting older or being out of shape. But your body is an incredible communicator, and ignoring its signals can be a fatal mistake. If you suddenly feel short of breath climbing a flight of stairs that used to be easy, that's a sign. If you feel an unusual pressure, tightness, or pain in your chest, that's a sign. If you experience new pain in your legs when you walk that goes away with rest, that's a sign. These aren't just minor annoyances, they are potential warnings that your cardiovascular system is in distress. The solution is to listen to your body and act on what it's telling you. In cardiology, we have a saying, time is muscle. The longer a heart artery is blocked during a heart attack, the more heart muscle dies. The faster you get treatment, the better your chances of a full recovery with minimal damage. Never assume a new concerning symptom is nothing. So there you have it, 10 habits that could be silently harming your heart. As you can see, protecting your heart is about so much more than just a single diet or exercise plan. It's a holistic approach. It's about your sleep, your stress levels, your social connections, and yes, even brushing your teeth. I know this list can seem overwhelming, but please don't let it be. These aren't 10 massive, impossible mountains to climb. They are a collection of small, daily choices. The journey to a healthier heart doesn't happen overnight. It happens one good decision at a time. My challenge to you is this. Start with just one. Pick the one habit from this list that feels most achievable for you right now and focus on that this week. Once it becomes second nature, pick another. Small, consistent steps add up to profound, lifelong change. If you found this video helpful and want to support our mission of bringing clear, actionable health information to everyone, please give it a thumbs up and share it with someone you care about. When it comes to our health, sharing knowledge is one of the kindest things we can do. And now I'd love to hear from you. Which of these 10 habits surprised you the most? Let me know in the comments section below. Thank you so much for watching, and here's to your long and healthy life.